Hello, Nighthawk Nation. Dr. H here. I want to just do a couple of brief, we'll call them lectures, over modules 1 and module 2, which here in the summer session, that's going to cover chapters 1 and chapter 2. And of course, we're discussing the history and overview of the U.S. healthcare system. So, moving on from there, we'll be looking at the learning objectives. Once you've completed chapter 1, you should be able to describe the 5 milestone sections of the history of the U.S. healthcare system and some of the events that have taken place during those milestones. You should be able to discuss the differences among primary, secondary, tertiary, and quaternary prevention, what is entailed in each of those. You should be able to analyze the concept of the iron triangle, understand it, know it, and be able to understand the importance of the triangle. And then identify pieces of social legislation and their importance. And these are all things that we'll cover throughout modules 1 and 2. The 5 milestones, these are medicine and medical education, nursing education, hospital and healthcare system, public health, and health insurance. And one of the options you had in your discussion post is actually discussing some of these. Some of the milestones of medicine and medical education, which we look at from starting in 1700 through today. We have things like the training and apprenticeships under one physician was common up until around 1765. There was really no education needed. You could follow a doctor around and then hang a shingle out and you were a doctor. The first medical school in the United States didn't come along until 1765, and that's Penn College in Pennsylvania, which was started by John Morgan and William Shippen. In 1847, the American Medical Association came about, and we began seeing regulations and standards at that point. But it wasn't until the 1910 Flexner that where we really saw a shift in where doctors had to be educated and there were guidelines and standards that they had to abide by. The next milestone would be nursing. Nursing education, really it started in and around 1798 in the United States when a New York physician developed a set of lectures for nursing education for maternity patients, to aid and assist in the birthing of babies, basically. In 1854, Florence Nightingale established guidelines for nurses' education called the Nightingale Principles. And in 1948, that's when the recommendation came down for nursing education be moved from the hospital system or from clinics into an academic setting. Realizing the importance of nurses in our healthcare system. Some of the milestones of hospital and healthcare systems, you really start seeing around 1820 almshouses or poorhouses, and these were the precursor to hospitals, and this is where the poor could go for food, shelter, and healthcare. In the 1930s, somewhere between 30 and 35, we began to see a shift from single-owner hospitals to group hospitals, businesses, and corporations owning hospitals. Really, the next big jump or step took place in 1985 with the passing of the Emergency Medical Treatment and Labor Act, EMTALA. And basically, this is stating if you go into an emergency room, it doesn't matter what you can afford, the hospital has to provide treatment. And that's for the birthing of children, that's for emergency medical situations, anything of that nature. Another milestone is public health. And we look at public health as from 1700 up through today. And really the focus in the early 1700s, there became a focus in the early 1700s on public health to protect workers. A lot of the work that was done in the 1700s in the United States, it was strictly manual labor, and they realized that they had a reduced labor force, and so this is when the public health really came into limelight. In 1920, Charles Winslow defined public health as a focus of preventing disease, prolonging life, and promoting physical health. And this was really the standard up until just recently when it was redefined by the World Health Organization. In 1950, there were multiple studies and reports that came out which we finally came to the realization that cigarette smoke was identified as an agent of cancer, as arguably the number one agent of cancer. And then probably the biggest milestone in the modern times, it was in 2010 with the passing of the Affordable Care Act and providing affordable healthcare insurance for everyone within the United States. Some of the milestones of the U.S. health insurance system in the 1800s, up until around 1847 is the approximate date, people could purchase what's called sickness insurance. And sickness insurance would help cover medical expenses if they were out, and it would pay for some doctors who worked along with the companies that sold the sickness insurance. We don't really see modern health insurance until 1929. Baylor of Dallas provided medical insurance to the school teachers within the Dallas school district. And this was the first case we saw of actual medical health insurance. And then, of course, one of the biggest milestones in healthcare in the U.S. was in 1965 when President Johnson signed into act the Medicare and Medicaid. And these are important dates to know. And so definitely you want to make note of anything that having to do with Medicare, Medicaid, and, of course, the Affordable Care Act. Some of the concepts of health, some of the three main concepts of how healthcare is provided to consumers will be covered in modules 1 and 2. Primary prevention avoids the development of a disease. This would, for example, be smoking cessations, immunization programs, educational programs. And when we refer to health, the World Health Organization actually defines health as the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And then when we look at things such as smoking cessation programs, this is referring to the American Lung Association or the Freedom from Smoking, and how they provide education, information, and programs to aid individuals to either prevent smoking to begin, or to help people stop smoking. When we look at immunization programs, a lot of these are going to be more on a local or state level. Typically, the Department of Health within your county is going to be who runs immunization programs, even though it's overseen federally. And then when we talk about the education programs for pregnancy and employee safety, things of that nature, these are organizations actually such as March of Dimes, the Red Cross. We have programs and government agencies such as OSHA, and this is what we're looking at when we refer to educational programs for pregnancy and employee safety. Some other concepts: secondary prevention. This is going to be focused on early disease detection, which prevents progression. And so this is when we get screened for high blood pressure, colonoscopies for cancer, mammograms for cancer. We have blood work drawn to catch the early onset of diabetes, amongst several other illnesses or diseases. And the importance, and we'll discuss this in later units or modules, that is the importance of catching this early prevention cannot be understated. And then we move into tertiary prevention, which reduces the impact of an already established disease by minimizing disease-related complications. This is more on the focus of rehabilitation and monitoring of diseases within individuals. We want to look at improving the quality of life in this situation by reducing the disability, limiting or delaying complications, and restoring function. This is done by treating the disease and providing rehabilitation. And then the quaternary prevention. This is an extension of tertiary prevention. It's the state-of-art medical care with a mindset of mitigating unnecessary efforts on care that may not be working. And this is also a step into making sure that we're not over prescribing or providing more care than what's actually needed to the individual. The iron triangle it's going to be something very important. You're going to see this coming up on quizzes and exams, and it's very important in the medical industry. You'll need this is something you'll want to know as a consumer, as a if you're a medical personnel or if you're on the business side of medicine. The 3 points of the triangle, we look at where problems may arise when we're looking at medical care. If there's an increase in cost, then there's typically a decrease in access to affordable health care. If there's a decrease in cost, then quality may suffer. So we want to maintain that balance of quality of care, keeping the cost at an effective manner and access at an effective manner, keeping a perfect triangle. The concept was created by Dr. William Kizik in 1994, and it's become a very effective healthcare system to maintain balance within the medical field. Some examples of social regulation you'll want to know. Such things as the Sherman Antitrust Act, which is a law that U.S. Congress passed to prohibit trusts, monopolies, and cartels. Its purpose was to promote economic fairness and competitiveness and to regulate interstate commerce. And basically, that way you don't have a single hospital system or a single insurance system driving the prices and deciding what care is going to be given and what isn't. It was passed by an Ohio senator by the name of John Sherman back in 1890. Some of the others that we see, the Newborns and Mothers Health Protection Act. This is guaranteeing health care for mothers and newborns in the hospital. There was a time when the mother would either give birth at home or give birth at the hospital and then be sent directly home because of a financial situation or what have you. Women's Health Care and Cancer Act, the Mental Health Parity Act. Mental health is a huge push right now, as well it should be. I think we undermine or underestimate the importance of mental health within our country, and so not enough can be said about that. And then, of course, in my opinion, the big one is the Affordable Care Act. So then we talk about different definitions. Title V of the ACA defines health literacy as the degree to which an individual has the ability to obtain and absorb basic health information to make the best health decision for themselves. And this is, you can think of this as a transparency where health policies and health insurance is written in a manner that it can be understood by the common individual, and that we don't need a team or a group of attorneys pouring through this. Also, individual health literacy, it's impacted by culture and the complexity of the health system. The ability of the health consumer to navigate these systems and communication by healthcare providers. The importance of health literacy cannot be understated. We, as a medical community, have an obligation to provide health education and to develop and increase health literacy among the public. In that way, every individual knows what rights they have and how they are impacted by the healthcare system. Some of the different definitions we'll see, and you can see that here on the slide, different definitions of health literacy. Everyone has the right to health information. Health services should be delivered in ways that are understandable and beneficial to health, longevity, and the quality of life, which is extremely important. Studies have shown that clinicians tend to have more negative attitudes toward people of color and unconscious racial bias among clinicians. And this is shown to have led to poor communication, lower quality of care, which is unacceptable. And the reason I led with that is that's what I think of when I think of social justice. Healthcare should be provided to every, and once again, in my opinion, every human being that's walking. We shouldn't decide that one individual is going to get better healthcare than another because of their social economic status, because of their race, color, or creed. Social justice in the healthcare focuses on the right of all individuals to have access to resources, including healthcare, which means health equity for all cultural groups. And that's just coming back to no matter who you are, no matter what you are, no matter where you're from, you should have the right to the same quality of healthcare as anyone else within our country. So to kind of wrap this up, when we think about the United States, it does actually not have a universal healthcare coverage program such as other countries. When we look at New Zealand, when we look at Switzerland, Australia, there are a lot of these countries have a universal healthcare plan, and we haven't quite gotten there yet. I think we are working in that direction, but it's not there yet. The U.S. healthcare system has many sectors which must communicate with each other to provide a quality of healthcare. So this goes back to the Iron Triangle. We have to make sure that we're providing the most effective care possible for the most effective cost possible, and making sure that we're providing accessible health care. We will cover this even more so, but just knowing that health disparities across the nation as a result of social injustice occur is something that we have to work towards as a society to overcome. And we'll cover this a little bit more throughout the semester. And then last but not least, social justice needs to occur to eliminate health disparities, which result in health equity. And that's just what we were just discussing. So once again, once we complete this module, you should be able to go and describe to anyone the 5 milestones of U.S. healthcare, the difference among the different health coverages, whether it's a primary, secondary, tertiary, coordinated prevention, the Iron Triangle, the importance of health literacy, and maybe know a few pieces of social legislation. So I try to keep this short and sweet. I just want to touch over a few of the things that might be of some help to you. If you have any questions, please let me know. Have a wonderful evening, a wonderful afternoon. Other than that, have a great semester, Nighthawk Nation. Dr. H.